And
Thank you very
yes,
much, sir. Now, we would like to again welcome you all in our 599th journey of knowledge sharing, AYUSH Samriddhi, on very unique topic, dental care in Ayurveda. We have three speakers, respected Madam Mridulata Maurya. Welcome, Madam. By heart, you are listening
Thank you,
us
sir.
from
Thank you.
platform.
Thank you, sir.
Welcome, Madam. Dr. S.K. Nayak from Ashtanga Ayurvedic College. Welcome. So from BHU, from Ashtanga Ayurvedic College, and my dear son, Dr. AYUSH Chattopadhyay. His father was principal of Ayurvedic College here. Unfortunate demise of his father, but he is the dental surgeon in Calcutta. So I welcome him also as speaker. And I welcome all the audience dignitaries. Welcome, sir. Nishant Shukla ji, namaskar. Madhu Sharma ji, Neelakshi ji, सुधाकर रेड्डी जी, आनंद कट्टी जी, सभी को दिल से नमस्कार। मैं इस वेबिनार के स्वागत प्रवचन के लिए आदरणीय वीके अग्निहोत्री सर को आमंत्रित कर।
thank you, sir. Thank you, Professor Pawan Sharma ji. It's a great pleasure to welcome our all the guest speakers of today's this second webinar, especially Dr. Mridulata Maurya ji. I'm sorry that I have not met even you had been there in BHU.
Yes, sir. Yes, sir. Yes,
I
sir.
complete my parikrama only up to Sanskrit department with Madam Nuru Methani or Mangala Gauri
Yes,
and
yes,
of course
sir.
Professor K. N. Dwivedi ji. This time
Ji,
I
yes,
met
sir.
Professor K. Pandey ji, but you are
Ji,
always
ji.
honorable to us, and we will be definitely going to get our knowledge increased in the field of the dental care by Ayush and especially IRES subjects. Of course, we just go for dental care, Gandushan, Kaval Dharan and all that for the
Yes.
oral hygiene itself. When the oral hygiene will be maintained, very naturally our denture will also be supposed to be intact. And again, our second speaker and third speaker, our three speakers are there. So the pleasure is this, that they are ready and accepted the invitation of Professor Pawan Sharma ji. It itself our achievement. Simply by name that you are here, you have been, and Dr. AYUSH Chattopadhyay ji, you have been given the distinction of being a son. So what more we can have? A son like you will definitely ornament our this webinar. Dr. Nitin Sharma has also joined. I also welcome him, and at the same time, our second guest speaker, I think he also joined.
Dr. S.K. Nayak sir from Ashtanga Ayurvedic.
Yeah, Dr. S.K. Nayak sir. Yes, I was just missing his name because I am not just going through our list. So Dr. S.K. Nayak, you are most welcome. And you see, as per our sequence, we will be having a lot of knowledge regarding this issue, and it will be an eye-opening information from your side, because we know that we are very careless regarding the dental health and dental care. We do nothing. Though the dental surgeons say that you go for twice this cleaning the brush and all that, the teeth with the brush. We were having our Danta Pavan. Tattado Danta Pavanam, Dadashangulum Ayatanam. And we say that our Danta Pavan is 3-in-1. It is brush, it is paste, and it is also a tongue cleaner, as we can use in a proper way. So this is, and it is always used as fresh. While as the today's brush are supposed to be ये 15 एंगल पर ट्रीटेड हो, ये स्प्रिंग वाला हो, ये स्टिल ब्रश वाला हो, ये राउंड ब्रिस्टल्स वाला हो, ये मिनी है, ये बेबी है, ये एडल्ट है, ये चारकोल वाला है, व्हाट नॉट. अपने पास इतना नहीं था. अपने यहाँ तो द्वादश अंगुल इतना मीन्स द यूजर्स 12 अंगुल. Moreover, the other thing, we use left side, right side. So all these things are definitely be incorporated by our Ayurvedic specialist with this reference. And of course, after taking dinner or lunch, teeth brushing is more important instead of at morning. because either you go for the flocks or you go for the full-fledged brushing. So with this small information, I thank you all and greet you that you please join our today's webinar with your great knowledge, and I return back this further connection to Professor Pawan Sharma. Thank you. नमस्कार.
बहुत बहुत धन्यवाद अग्निहोत्री सर, बहुत बहुत धन्यवाद. मैं आदरणीय अतिथि वक्ता मैडम मृदुलता मौर्य जी को सम्मान सहित आग्रह करता हूं कि वो आयुर्वेद में डेंटिस्ट्री या डेंटल केयर की हमें मार्गनिर्देशन दें. वेलकम मैडम.
Thank you, sir. Thank you so much, sir, for inviting me on this and giving me a wonderful platform to share my views on the dental care in Ayurveda. I share the screen. Okay, sir. It is visible.
It's very
Myself,
clear. Yes.
Okay. Myself, Dr. Mridulata Moore, Assistant Professor in Salakirtan, Faculty of Ayurveda, Institute of Medical Science, Banaras Hindu University, Varanasi. Actually, Salakirtan is the branch of Ayurveda that deals with the disorders of supraclavicular region, and dentistry in Ayurveda is included in Mukh Rog of Salakirtan. That is the most important part of the Ashtanga Ayurveda. And Mukh Rog is described in Susut Nidanasthan, 16th chapter, and its Chikitsa is described in Susut Chikitsasthan, 22nd chapter. According to Acharya Susuta, there are 65 Mukh Rogas are described, and there are 7 sides: diseases of lips, diseases of periodontium, diseases of tooth, diseases of tongue, that is 5, and diseases of palate, 9, diseases of pharynx, 17 diseases, and diseases of entire oral cavity, that is the 3. So total 65 in number Mukh Roga. Here you see the oral cavity and the pharynx. Here all the 7 sides described in the Acharya Susuta are there: lip, gingiva, tooth, entire oral cavity, and pharynx, palate, and tongue. This is the diseases of lips. There are 8 diseases described: Vatas, Pittas, Kaphas, Sanipatas, Raktas, Mansas, Medas, and Abhighatas Ostro. There are some pictures of the lip diseases. In first picture, it is the picture of cracked lip. In second picture, we see the aphthous ulcer. And in third picture, that is the case of the carcinoma of lip. And in fourth picture, it is the case of the macrochilia of the lip. Next site is the periodontium. There are 15 diseases described: Sitad, Dant Puputa, Dant Vestaka, Sausir, Mahasausir, Paridar, Upkush, Dant Vaidarbh, Vardhan, Adhimans, and 5 types of Dantanadi. Here are the some cases of periodontal diseases. In first picture, it is the case of gingivitis. In second case, periodontitis. And in third, it is the case of pyorrhea. There is the arrows sign. There is the discharge, first discharge from the gingival crevices. And in fourth picture, it is the case of the pericoronitis. There are 8 diseases described in Sususainta: Dalan, Creamy Danta, Dantahars, Bhanjanak, Danta Sarkara, Kapalika, Chavadant, and Hanumoksh. It is the in first picture, it is the case of the cracked lip. In second, that is the creamy dant, dental caries. In third, dantahars, sensitivity of the tooth. In fourth picture, it is the bhanjana, fractured tooth. And danta sarkara, in first picture, dental tartar. Second, kapalika, enamel separation. And syavadant, it is actually the dead of the pulp tissue, and it is called the black tooth, syavadant. And hanumoksh is also described in the dental diseases. That is the dislocation of TMJ, temporomandibular joint. Diseases of tongue, it is the 5 types: vatas, pittas, kaphas, jiva, that is the glossitis, and alas, that is the carcinoma of tongue, and upjivika, that is the tonsillitis. It is the picture of tongue diseases, some tongue diseases. First picture shows the glossitis. Second is the carcinoma of the tongue. In third picture, it is the case of tonsillitis. And in fourth picture, it is the case of ranula, that is the adhijiva described in the Bhagavata. There are 9 diseases of palate: Gal Sundika, Tundikeri, Adhrus, Talu Kachap, Talu Arbut, Mansa Sanghat, Talu Puputa, Talu Shosha, and Talu Pak. In first case, we see the uveitis, and in second case, it is the palatitis. And in third case, that is the carcinoma of palate. And in fourth case, due to the prosthetic appliance used, there is the disease occur, epulis of palate. And there are the 17 diseases of pharynx, 5 types of rohini, that is the facial diphtheria, kantha saluka, adhijiva, valay, valas, ekvrinda vrinda, satagni, gilayu, galvidradhi, galond, swaragna, mansatan, and bidari. In first case, it is the case of the facial diphtheria, and in second picture, it is the case of the carcinoma of throat. And diseases of the entire oral cavity, there are 3 diseases described in Susuta: Vatas, Pittas, and Kaphas. Sarvasar Roog, that is the stomatitis, and this is the cases of the stomatitis. And what is the dental caries described in Ayurveda? It is a path given to the modern dentistry also. Here, symptom and sign are described. Tooth become blackish and develop the discharge filled along with the cavity formation. Patient feel mobility of tooth and toothache on and off. Acharya Susut and Bhagavad both described this sign and symptom. And what is the treatment described in Ayurveda? There are 2 treatment plans. If tooth is not mobile, there is the other line of treatment, and if tooth is mobile, there is the line of treatment is different. If tooth is not mobile, first, what is the said here? Fomentation, yani Swedan come. Second, Rakt Vishraman come. Third, oleation, nasal oleation, that is the Nasekan, and local massage with medicated oil, and unctus diet with poured grit and tala, according by Acharya Susutta. And Acharya Bhagavad described if tooth is not mobile, oil pulling, that is the Gandus, and we compare with the Kaval and Gandusa. And second is the restoration. In ancient time also there is the restorative materials are used, and cavities should be filled with the jaggery or wax along with the cauterization ani agnikarma, and fill the cavity with the milk of arka, that is the Calotropis gigantea, and Saptaparni, Allostonia scoloris. Both milk kills the bacteria and relieve in toothache. According to Bhagvat, there is a very wonderful description for the restoration and the cavity filling. What is the dental restoration? It is a treatment to restore the function, integrity, and morphology of missing tooth structure resulting from caries or trauma, as well as to replacement of such structure. Restoring a tooth to good form and function required two steps: preparation of tooth and placement of restorative material. Material may be jaggery, wax, gold, amalgam, dental composites, glass ionomer cements, or porcelain, among others. Process of preparation usually involving saving of the caries tooth cavity with a rotary dental brush to make a space for planned restorative material and to remove any dental decay or portion of tooth that are structurally unsound. They are of two broad types. First is the direct restoration and second is the indirect restoration. Indirect restoration, this technique involves placing a soft or malleable filling into the prepared tooth and building up the tooth structure. And material is then set hard by passing limited energy, that is the heat, from the setting process. This is the case of the dental restoration. First, prepare the cavity and after that, filling the restorative materials. In indirect restoration, in this technique, the restoration is fabricated outside of mouth using dental impression of prepared tooth. Common indirect restoration include inlays, outlays, crowns, bridges, and veneers using gold and ceramics. Usually, a dental technician fabricates the indirect restoration from cards the dentist has provided, and the finished restoration is usually bounded permanently with a dental cement. While the indirect restoration is being prepared, a provisionary temporary restoration is sometimes used to cover the prepared tooth, which helps to maintain the surrounding dental tissues. This is the case of indirect restoration. Here we see there is the missed tooth, and after preparing the dental cap from outside, it is placed on the prepared area with the cement. RCT, what is the RCT? It is the root canal treatment. It refers to a procedure accomplished in several phases in which all traces of pulp tissues are removed from pulp chamber and root canals of a badly diseased tooth. And first step is to take an X-ray to see the shape of root canals and determine if there are any signs of infection in a surrounding bone. Anesthesia may not be necessary since the nerve is dead, but most dentists still anesthetize the area to make the patient more relaxed and at ease. After a hole is made in tooth, the root canals are filed out and irrigated to remove the infection. Then the canals are treated with medication and sealed tightly. The damaged crown is then repaired by composite resin and light cure filling. And after that, permanent restoration, that is the cap, is placed on same tooth to protect it, prevent it from breaking, and restore it to the full function. Here we see in first case, it is the healthy tooth. There is no cavity or caries. In second, it is the case of decayed tooth, and the decays infection get down to the apical foramen and periodontal tissues. And in third, it is the RCT treatment, and in fourth, it is after RCT, it is the restored tooth. In dental caries, as I said, if tooth is mobile, are not possible to restore the tooth, treatment is the extraction of tooth and then cauterization of root socket, and after that Nassekarm is done according to Acharya Susuta and Bhagvat. Both describe the extraction and cauterization with Nassekarm. So I I must say that Sustuta and several other treatises have elucidated the etiopathogenesis, signs, symptoms, and complication of different modalities and treatment of various oral diseases are not ignorable in modern era also. In spite of vast development of modern science, satisfactory treatment of oral diseases by newer drugs are not achieved rather than the chemical compounds have exposed the patient to their different ill effect. And if you see the evolution of tooth cleaning, actually, animal never clean their teeth. Probably, man in ancient time also never cleaned his teeth, as his food contained lot of hard and rough substances which had a natural cleansing action on teeth. With civilization, man started using more and more cooked and processed food, and hence the need to chew food grew less and less. As a result, the third molar have become a vestigial structure in most persons. The cooked food sticking to dental crevices serves as a good medium for bacterial growth. Therefore, it is essential to clean the teeth twice a day. Acharyas have beautiful illustrations about different ways and means of maintaining oral hygiene and description of tools is used. The twigs of herbs like babool, neem, described in ancient Ayurveda literature, have anti-plaque and anti-cariogenic properties. This action supposedly draws out toxins from oral cavity and improves the oral health. Twigs of herbs also have their own properties which rebalance oral cough and help in maintaining the alkalinity of saliva. And varieties of Ayurvedic dravyas such as turmeric, triphala, cinnamon, cardamom, tamalpatra, tejbal, clove, black pepper, pipali, and ginger are used as chewing dravyas for various gum and oral diseases. Next, there are the description of Kaval, Gandusa, and Pratisaran in ancient literatures of Ayurveda. And in modern, Kaval Gandusa compared with the oil pulling. And oil pulling is twisting oil around inside oral cavity, pulling back and forth through teeth and gum for 15 to 20 minutes, and then spit it out. Here the oil penetrates the oral mucosa and gums by pressure and exerts its specific action, that is the cleansing and healing action both simultaneously. And Pratisaran is the gum massage, and gum massage with sesame oil or coconut oil because of its anti-inflammatory and antibacterial properties. The antibacterial nature of oil strips away bacteria and gives whiter teeth, stronger gum, and curbs bad breath. Why smile? We all smile in pictures to keep memories of happy times like holidays captured on film. It makes younger look. It reduces the stress level by decreasing cortisol in body, and it boosts our immune system by releasing dopamine in body, and it releases endorphin and serotonin, which helps a person feel happier and more positive. And last but not the least, it helps in better relationship with family and boss also. So say bye to dental caries. Keep smiling. Thank you. Over to you, sir.
Thank you. Thank you very much. Thank you very much, madam. You have covered almost all the things regarding oral and dental problems in Ayurveda. Very nice. Along with the modern also. Please do join every day. This is my humble request. And communicate us the topic of your choice for speaker. Dr. Agniotri,
Yes,
sir.
sir. Thank you, sir. My pleasure.
Thank you, Dr. Madhulita Mauryaji.
Thank you, sir.
It's my pleasure too. and especially I just came to know about you today, just in this webinar. Though you are right now simply assistant professor, but still knowledge is not of assistant professor level, it's beyond of that. And
Thank
as
you, sir.
I was expecting that the oral health, especially the oral hygiene and health, will be the main part of this thing. Though they have now changed the names like pulling. Pulling, it was simply decoction using or plain water or medicated water in form of gandush. And if the pulp is used, it is known as kalk,
Kaval.
kaval. As we know that
Kaval.
asanchari mukhe purne, gandusha
Yes,
kavalascha.
yes.
So
Yes, sir.
this is the thing, and my pleasure is that being your PHU alumnus and senior one, it is always giving me a pleasure that you are there. Of your department, Dr. Anil Verma, a very
Yes,
senior
sir.
professor. He is here. He is now retired professor.
He is
So it's
retired also.
yeah,
He is
here
retired.
now he
Yes.
is in Patanjali after Bareilly College. So
Ji,
our
ji, ji.
pleasure is that please not only you join, but you convey your all faculty members, your PG scholars and scholars. So they should also be a part of our webinar. Then the strength will be, not only the strength will be high, but the knowledge will also be shared by so many persons. So thank you
Circulated.
so much. Thank you so
Thank
much.
you, thank you, thank you, sir. My
Namaskar.
pleasure,
Namaskar.
sir.
Yeah.
Thank you very much. Now I would like to request Dr. S.K. Nayak ji. Dr. S.K. Nayak ji, am I audible to you?
हाँ सर, नमस्कार सर.
Welcome. Welcome.
Shall I start, sir?
Yes, you are most welcome. It is your platform.
Okay, thank you, sir. Let me share my screen. Is it clear to you, sir?
Yes, very clear.
Okay, sir. Thank you, sir. सामान्य प्रोफेसर पवन कुमार शर्मा जी, प्रोफेसर विष्णु प्रसाद शर्मा जी, प्रोफेसर विनीत कुमार अग्निहोत्री जी, माय को-स्पीकर डॉक्टर मृदुलता मौर्य मैडम, डॉक्टर चट्टोपाध्याय जी, डॉक्टर भार्गव जी, और यहाँ पर उपस्थित समस्त आयुर्वेद के विद्वान गण, आज अंतर्राष्ट्रीय डेंटिस्ट डे है और इंटरनेशनल डेंटिस्ट डे के ऊपर डॉक्टर पवन शर्मा जी का निर्देश था कि आज डेंटल केयर इन आयुर्वेद के ऊपर अपना मत रखने के लिए, इसलिए मैं डॉक्टर पवन शर्मा जी का हृदय से आभार हूँ आप इतने बड़े प्लेटफॉर्म में मेरे को शामिल करने के लिए। और आज मैं डेंटल केयर इन आयुर्वेद के ऊपर अपना मत रखने जा रहा हूँ। सो आई welcome you all to this webinar. In Ayurveda, there is one definition given for mukha. That means Ostaucha Dantamulani Danta Jivacha Talucha Galo Mukhadi Sakalam Saptanga Mukha Muchete. So regarding mukha, it is told that there are 7 parts present in mukha. They are Osta, Dantamul, Danta, Jiva, Talu, Gala ebam Sakal Mukh, entire oral cavity. So there are 7 parts which are described in Ayurveda about mukha, and in mukha there are around 65 diseases occur. It is described in Ayurveda. And regarding oral health, definition of by WHO, the definition of oral health, it is told that oral health is a state of being free from chronic mouth and facial pain, oral and throat cancer, oral sores, birth defects such as cleft lip and cleft palate, periodontal or gum disease, tooth decay, tooth loss, and other diseases that affects oral cavity. So when we'll say that the oral health is in a good stage, that means it must be free from all kind of chronic mouth disease, facial pain, oral and throat cancer, oral sores, birth defects, cleft lip, cleft palate, and all kind of periodontal disease. Now, the question comes, what is the need of oral health? Yeah, oral hygiene. Several recent clinical studies suggest that oral disease and inflammation may be potential risk factor for different systemic diseases like cardiovascular disease, bacterial pneumonia, low birth weight, diabetes complications, and osteoporosis. These are the systemic complications which come out of improper oral hygiene. So it is very important to maintain oral hygiene to its best. If we come to the statistics, according to WHO, it is told that worldwide 60 to 90% of school children and nearly 95% of adults, they have having dental caries. So dental caries, it's a great problem nowadays. Along with that, severe periodontal disease is found in 15 to 20% of middle-aged adults. And globally, about 30% of people aged between 65 to 74, they are having no natural teeth. So nowadays, the dental and orodental disease, they are becoming very much common in our society. Similarly, 28% of children aged between 2 to 5 years, they are having decay in their primary teeth in America. 50% of children experienced tooth decay by the age of 11. 68% of 19-year-old, they are having tooth decay in permanent teeth. And it is found that low-income group people, they are having twice likely than higher group. So it is seen that dental and dentogingival diseases, they are very much common in our society nowadays. Similarly, 27% of adults having age 20 to 39 years, they are having untreated dental caries. And 21%, they are having 40 to 59 years, they are having dental caries. And similarly, 19% of 60 plus year persons, they are having dental caries. So from this, we can know that dental caries is the second most common disease in our community after common cold. Common cold के बाद अगर देखा जाए तो dental caries जो है, it is coming in second position among all kind of diseases. So it is very important to make our oral hygiene clean. It prevents aspiration pneumonia. If we clean our mouth, then it prevents aspiration pneumonia, gum disease, and helps prevent heart disease. What is good oral hygiene? Good oral hygiene हम किसे कहेंगे? The good oral hygiene results in a mouth that looks and smells healthy. That means your teeth are clean and free from debris. Your teeth must be clean and they must be free from debris. Then gums are pink and do not hurt or bleed when you brush or floss. Your जो gum है ये bleed नहीं होना चाहिए during brushing या flossing. Then bad breath is not a constant problem. अगर ये सारे लक्षण मिलते हैं, so that we can consider that is a good or healthy gum. So good oral health is the need of each and every individual. Risk factors क्या होते हैं? Unhealthy diets, tobacco use, harmful alcohol use, or poor oral hygiene. So these are the different risk factors for different kind of oral disease. If you go for improper oral care, improper oral hygiene maintenance, that will lead to two things. Number one, the formation of plaques, and number two, formation of tartars. So let us know what is plaque. Plaque is a sticky, colorless film of bacteria and sugars that constantly forms on our teeth. The colorless film of bacteria and sugars that forms over our teeth surface, that is called plaque, and it is the main cause of cavities and gum disease that can harden into tartar if not removed. So all kind of gum diseases are formed out of plaque, and when the plaque is hardened, it becomes tartars. If everyone develops plaque because bacteria are constantly forming in their mouth, and the bacteria use ingredients found in our diet and saliva to grow. Similarly, tartars or calculus is the plaque that has hardened in our teeth, and the most common sign of tartars is yellow or brown color to teeth or gum. These are the tartars which are formed in interdental spaces. In Ayurveda, the concept of tartar is also there. That is told that sarkareva sthiribhuta malo dantesu yasyavai sadantanam gunahari bigeya danta sarkara. So in Ayurveda, the tartars are called danta sarkara, and they are called danta sarkara. Sarkara means hardened, stone-like structures. So when the danta mala they becomes hard, they are called danta sarkara. And when these danta sarkaras come out, they get injury to the enamel surface of the teeth. That condition is called kapalika. So kapalika is a disease where dalanti danta balkani yada sarkarayasah geya kapalika seva dasananam vinasini. So when that danta sarkara, the tartars, when they come out with having the tear in the dental surface, that is enamel, so that condition is called kapalika. So these tartars and the plaques, they are the most common villains. They are causing all kind of dental disease. Process of tooth decay. How tooth decay? This is the process that they are mainly caused by bacteria. Though some bacteria, they are good, they control destructive bacteria, and the bacteria, those who cause decay in tooth surface, they are Streptococcus mutans, lactobacilli. So these are the bacteria, they cause different kind of tooth decay. The bacteria in our mouth, they need food to live and multiply. When we eat sugary foods and other carbohydrates, the bacteria use them as food too. So the bacteria, they are using the food which we are eating, and then the bacteria they produce acids, and that can dissolve the mineral crystal of the teeth. They produce one acid, and that acid dissolves the external surface of the teeth, that is enamel. And the more time we eat each day, the more times our teeth are exposed to acid attack. जितना बार हम खाना खाते हैं, उतना बार हमारा टीथ में एसिड अटैक होने का चांसेस बढ़ जाते हैं. So the foods that break down into simple sugars in mouth are called fermentable carbohydrates. ये जो carbohydrates easily break down हो जाते हैं simple sugar में, इसको हम कहते हैं fermentable carbohydrates. और ये fermentable carbohydrates कहाँ मिलते हैं? जहां आजकल जो फास्ट फूड्स होते हैं, जैसे चिप्स है, जैसे कोल्ड ड्रिंक्स है, जैसे आइसक्रीम है, जैसे कुकीज है, जैसे क्रीम्स है, ये सारे चीज जो होते हैं, जो आजकल बच्चे ज्यादा पसंद करते हैं, और ये सारी चीज जो होते हैं, दे आर कॉल्ड फर्मेंटेबल कार्बोहाइड्रेट्स, एंड दे आर वेरी मच रिस्पॉन्सिबल फॉर कॉजिंग ऑल काइंड ऑफ डेंटल डिजीजेस, पर्टिकुलरली टूथ डिके या डेंटल कैरीज. द आटा कैन लीड टू टूथ डिके, आल्सो नोन एज डेंटल कैरीज. जैसे प्रीवियस स्पीकर ने बताया कि जो डेंटल कैरीज होते हैं, और दे first the acid begins to dissolve calcium and phosphate crystals in the tooth. So this is the process by which tooth decay starts. A white spot may appear in the enamel in this weakened area, but the loss of minerals develops beneath the surface of the enamel. पहले enamel surface में एक छोटा सा छिद्र होगा, और यहीं से decay शुरू होना चालू हो जाता है. At this stage, the tooth can be repaired with the help of fluorides, proteins and minerals. ये जो स्टार्टिंग स्टेज में अगर हम फाइंड आउट करते हैं या डायग्नोज कर देते हैं, तो इस केस में हम रिपेयर कर सकते हैं. और जब ये ज्यादा ग्रेवियस स्टेज में चला जाता है, तो उस कंडीशन में वी कैन प्रिवेंट द टूथ. वंस द डिके ब्रेक्स थ्रू द एनामेल टू कॉज अ कैविटी, द डैमेज इज परमानेंट. वंस द कैविटी इज फॉर्म्ड, द डैमेज बिकम्स परमानेंट, एंड द लेफ्ट अनट्रीटेड डिके विल गेट वर्स. धीरे धीरे क्या होता है, that decay that will become worse. It can destroy a tooth all the way through the enamel, through the inside dentine layer, and down to the pulp or the nerve of the tooth. Once it enters into the pulp cavity, the patient starts getting pain, and that is the time patient gets pain, and that's why it is important to treat caries at very early stage. So when we diagnose a case of dental caries in the early stage, and if we provide treatment, then we can prevent the disease. This is the concept of tooth caries. Kisnachidi chalstravi sansarambho maharujah anevitarujabatat begeh krimidantaka. So these are the different descriptions which are found in Ayurveda. Like dental caries, some gum diseases are also described in Ayurveda, and they are very common. And the most common gingival disorders, they are gingivitis, periodontitis, and advanced stage of periodontitis. So these are the three more common gingival diseases which are found in society. So gingivitis, that is due to plaque toxin, the plaques that they produce toxins and they produce irritation on the gum tissue that causes tissue reaction, and finally they cause gingivitis. So gingivitis, the predisposing factors are poor oral hygiene, pregnancy, uncontrolled diabetes, misaligned teeth, use of certain medications, and smoking and poor nutrition, vitamin C, stress, mouth breathing. So these are the different predisposing factors for gingivitis. Symptoms, the most common symptom is bleeding gum, then bright red or red purple appearance of the gums, mouth sores, bad breath, receding gums, swollen gums, shiny appearance of the gums. These are the symptoms of gingivitis. Then when we go for examination, we get mouth and teeth examination, soft swollen tissue, red purple gums. Gums are most often painless and mildly tender. Plaque and tatters may be present. So these are the findings when we go for examination. Like that, periodontitis is the most common cause, which is called in Ayurveda, it is called Dantavesta. And in periodontitis, what happens? The supporting bone and fibers that hold our teeth in place are irreversibly damaged. The periodontal ligaments, they are damaged, and the tooth becomes loose, and there will be gingival pockets will be formed. See, this is a case of periodontitis, and here when we are doing probing, we will get gingival pockets in the dental area. So these are the different signs and symptoms of periodontitis. Symptoms mean in symptoms you will get bleeding gums, increasing spacing between the teeth, loose teeth, usually painless, and sensitivity towards heat and cold, food impaction, halitosis, gingival tenderness. So these are the different signs and symptoms which are found. Treatment in periodontitis, there initially scaling and root planning is done, antimicrobial therapy is done, improvement of oral hygiene done, removal of all factors. So these are the treatments which are given, and finally it is not if it is not treated by medicine, you can go for surgical treatment. The surgical treatment, it includes pocket elimination procedure, regenerative therapy or resective therapy, flaps or without osseous surgery, then gingivectomy. So these are the different surgical treatment which can be done. In Ayurvedic, we can give some medicines, very effective medicines are there in Ayurveda. Like in Manjan, you can give Dasan Sanskar Churna, you can give Kalak Churna, you can give Dasarog, Dantarog Nasini Churna. These are the drugs which can be used for Manjana Karma. Then for Chushanartha or Soaking, you can give Khadiradi Gutika, you can give Chara Gutika, you can give Sahakarvati, you can give Mukharogharivati, Pathyavati. So these are the different medicines which can given for soaking or chushanarth. Then for Pratisaran, Lodra, Muleti, Laksha, Rakta Chandan with honey. These are the drugs which are given for Pratisaran. Then Abhyandar Prayogarth, you can give Parvati Rasa, Chaturmukha Rasa, Malatyadi Kritam. These are the drugs can be given Abhyandar Prayog. And for Kaval and Gandush, there are so many medicines, effective medicines are there, like Irmidyadi Tel, Sahachar Tel, Bakula Tel. Then you can give Sont, Sarsap, Triphala, Nagarmotha. These Patha with Rasanjan Prakshep can be done. Then Chiribriksha Kasai with Madhu and ghee and Sarkara. This can also be given in case of all kind of Dantagata Rogas. Similarly, stomatitis is also a very common disease in Mukharoga. So causes are injury mechanically, chemically, thermally, radiotherapy, idiopathic malnutrition. These are the causes of stomatitis. Generally, three kinds of stomatitis are found: traumatic stomatitis, aphthostomatitis, and monoileal stomatitis. So in traumatic stomatitis, there is vigorous use of hard brush, ill-fitted dentures, jagged teeth, simple cut or burn. So these are the causes for traumatic stomatitis. And treatment you can give frequent washing of mouth with saline or thymol. A few drops of Dettol may be instilled in a glass of water, and rinsing the mouth with such water is quite effective in controlling stomatitis. So this can be given. Similarly, arthrostomatitis is or recurrent arthrostomatitis. This is also a very common condition which are found in Mukharoga. See, this is a case of arthrostomatitis. Here you can see a white color ulcers in the inner side of the lip. Similarly, these ulcers can also be formed in the inner side of the tongue or cheek also. So treatment is culture should be taken from the lesion and appropriate antibiotics should be given. So this kind of treatment can be given. Similarly, monilial stomatitis is also there, which is also called oral thrush. So this is a picture of oral thrush or monilial stomatitis. This is a picture of monilial stomatitis also. So monilial stomatitis is a very common condition which is caused by Candida albicans. Similarly, apart from stomatitis, oral cancer, it is also a very common condition nowadays. It is the 6th most common cancer reported globally. Oral cancer is the 6th most common cancer, and with an annual incidence of over 3 lakh cases. So see how pathetic is this condition. Oral cancer vary from 20 per 1 lakh people individual in Indian population to 10 per 1 lakh individual in US. So in India, it is more common than other countries. In US, oral cavity cancer represents only 3% of all malignancies, and it occurs over 30% of all cancers in India. So this is a very common condition which are found in nowadays in India. And oral cancer, tobacco use and alcohol are known risk factors for cancers of the oral cavity. In India, 57% of all men and 11% of women between 15 to 49 years of age, they use the form of tobacco. So 57% men and 11% of women, they are using in tobacco in any form. So in Ayurveda, oral hygiene, for maintenance of oral hygiene, there are so many instructions are given like Dantadhavan, Jivan Lekhan, Nasya, Gandusha, Dhumapan, and Tambula Charban. So these are the different advices are given to prevent different kind of oral diseases, like using up dhatuns. Then you can use Nimba, Karanja, Khardira, Madhuka, etc. for dhatuns purposes. Similarly, the frequency of toothbrushing is told that minimum 2 times a day, which is advocated by Acharyas in Ayurveda. Similarly, advantages of Dantadhavan, it says Dantadhavan removes food debris, annamala, plaque or dantamala, and mucus secretions or kapha collected in mouth and tongue overnight, elevates halitosis, and person feels fresh and appreciates the taste and food for better way. So these are the benefits of Dantadhavan. Similarly, cleaning of tongue or Jivanilekhan. This is also one indication which is given in Ayurveda. Benefits of tongue cleaning: it removes waste materials, bad odor from mouth, improves taste sensation, exerts a tonic effect to the tongue. So these are the benefits of tongue cleaning. Then next is Nasya. So Nasya Karma is also advocated in Ayurveda it also improves oral hygiene and prevention of all kind of diseases of Urdhva Jadrugata. So Nasya, Pratimasa Nasya of Tila Taila, it is also indicated in Ayurveda. Similarly, Gandusha and Kaval, these are also given. Dhumapan, and lastly, the Tambula Charban. Tambula Charban is also, it is Kaphanasaka, and it improves it elevates the kapha in mouth, and it improves the digestion process in our body. Tambula Patra, Puga Churna, Jati Phala, Katuka, Ela seeds, etc., Lavang, etc. These are used for this Tambula Charban, and benefits are elevation of tridosas, Srodasudhi, prevents the disease of oral cavity, ENT, fragrance of the mouth, and improves the taste sensation. So these are the benefits of Tambula Charvana. So we have to follow the 8 steps to get proper oral hygiene. Now, number 1, understand your own oral health needs. then commit to a daily oral health routine, use fluorine products, brush and floss daily to remove the plaque, then reduce the number of times each day that you consume fermentable carbohydrates, eat balanced diet, and if you use tobacco in any form, then quit, then a regular oral checkup. So these are the 8 steps which can be followed for maintenance of good oral hygiene. Then use of fluoride toothpaste, this can also be done. Then the most important thing is toothbrushing. Toothbrushing, most of people don't know how to brush your teeth. So this is the process by which you can do toothbrushing. Brush at least twice a day, morning and before going to bed. Brush lightly, brush for at least 2 minutes. Have a standard routine brushing. Then always use toothbrush with soft or extra soft bristles. Change your tooth, brush regularly. Use fluoridated toothpaste. Tilt the brush at 45-degree angle against the gum line and sweep or roll the brush away from the gum line. Then gently brush the outside, inside and chewing surface of the teeth. Then using short back and forth stroke. Gently brush your tongue to remove the bacteria and freshen the breath. Then next technique is flossing. Flossing is, it is the best floss is the one you are going to use. Waxed, unwaxed, plain, mint, cinnamon, white, regular size floss or any type that helps clean and remove the plaque. फ्लसिंग क्या होता है, ये एक थ्रेड होता है, ये थ्रेड क्लीन थ्रेड को हम दोनों उंगली में लेके हम इसको दोनों दांत के बीच में फंसाते हैं. तो इसमें क्या होता है ना, दोनों दांत के बीच में जो मल रह जाते हैं, जो डेब्रिस रह जाते हैं, तो ये फ्लॉसिंग के द्वारा बाहर निकल जाते हैं. सो इट इज ए प्रोसेस व्हिच कैन बी डन रेगुलरली. सो दीज आर द प्रोसेसेस ऑफ फ्लॉसिंग. Gently carve the floss around the base of each tooth, making sure you go beneath the gum line. Never force the floss, as this may cut or bruise or a delicate gum tissue. Use clear sections of floss as you move from tooth to tooth. To remove the floss, use the same back and forth motion to bring the floss up and away from the teeth. So these are the processes by which you can go for flossing. Then tobacco use and oral health. Smoking increases the risk of mouth pain, cavities, gum recession, gum disease, and tooth loss. So smoking is a very much dangerous thing which can be causes different kind of oral disease or gum disease. So in fact, an estimated 50% of adults who smoke have they have gum disease. जो 50% लोग होते हैं जो स्मोक करते हैं उनको गम डिजीज या डेंटल डिजीज होते हैं. So smoking must be quit. According to the Academy of General Dentistry, a 1 pack a day smoking habit can cause to lose at least 2 teeth every 10 years. जो 1 पैकेट पर डे स्मोकिंग करते हैं, इनका देखा गया है कि जो 10 साल में मिनिमम 2 दांत खराब हो जाते हैं. So it must be avoided. Like smoking, the chewing tobaccos, they also be avoided. And it is not just smoking tobacco that has negative effects on your oral health. Use of smokeless tobacco causes bad breath, discolored teeth, promotes tooth decay. They have a decreased sense of smell and taste, and a 50% greater risk of developing cancers of the cheek, gums, and lining of the lips. So it is important to stop chewing tobaccos. Then balanced diet is a must. For maintenance of oral health, the best food for your health is breads, cereals, cheese, chicken, other meat, and fresh nuts, milks, and yogurts. These are the foods which can be taken for good oral health. Apples, pears, and green vegetables, they can also be used for maintenance of oral health. Then you should avoid citrus fruits, tomatoes, and lemon, etc. They can cause different kind of dental diseases. So citrus fruits should be avoided. So finally, at the end, I can say that avoid risk factors. जो risk factors है उसको avoid करिए. Brush at least twice daily with fluoridated toothpaste. Minimum दो बार toothbrush करिए. एक बार सुबह और एक बार रात को सोने से पहले. और if you are using fluoridated toothpaste, then it is better. देन फ्लॉस डेली फ्लॉस करें, अवॉइड शुगरी डाइट, जितना हो सके उतना शुगर डाइट अवॉइड करें, टेक बैलेंस डाइट, जो बैलेंस डाइट होते हैं उसको हमेशा लेने के लिए कोशिश करें, एंड फाइनली एंड लास्टली आई कैन से रेगुलर ओरल चेकअप एटलीस्ट ट्वाइस ए ईयर, मिनिमम 2 बार 1 साल में अपना ओरल हेल्थ का चेकअप करना सुनिश्चित करें, सो दैट यू विल गेट ए वेरी गुड ओरल health. So with these words, I thank you very much for giving me a chance. I am thankful to Dr. Pawan Kumar Sharma ji and entire team for giving me a chance to share my views with you. I wish you all a very happy International Dentist Day and wish all the best. Thank you very much. Thank you so much.
Thank you very much, Dr. Nayak. Thank you very much. You are excellent as always. We are listening you second time, but really you are excellent. Great. Agnihotri sir.
Thank you, sir. Thank you very much.
Thank you, sir. Thank you, Professor Pawan Sharma ji. Thank you, Dr. S.K. Nayak, sir. You completed the fullest information pertaining to oral cavity, denture, tooth, gum, oral hygiene, everything. I'm not putting the question, and the questions will be taken in that discussion. Simply one point in my mind I'm keeping. You told that common cold is one of the cause of the dental caries. You may answer afterwards.
No, sir. Sir, may answer?
How it can be tagged? How it can be tagged?
Sir, I have just told that common cold is the most common disease which are found in our society. It is
Yes,
the
sir.
number one disease is common cold. Then after
We
could not getting the samprapti of this thing, and we will take this question afterwards. Please, our third speaker is there.
He has prioritized, not connected both. First number is common cold and second number is dental care.
Yeah.
A person who is suffering repeatedly from common cold may get dental caries, like that. Or
Okay.
not?
No. That is not the case.
Okay, thank you. I got it.
Okay.
No problem. Okay. That's why it is tied in my mind that how it is possible like that. Okay, thank you so much. Thank you for your best presentation.
Now I would like to request Dr. Ayoshik. Welcome, Dr. Ayoshik. Welcome. You can share your presentation.
Hello. Is I audible?
Yes, clear.
So a very good evening to everyone. Everyone is very much senior to me, and I will like to thank Dr. Pawan Sharma for giving me this stage and keep my words with all the senior doctors present here. And basically, I will like to say that sirs and ma'am has already covered each and every detailed points of the main topics which we basically face day by day. But today I will just add a few points which I think that we should, being a doctor, rather in any field, we should always keep in mind that few common problems which we daily skip in our lives and being in our practice too, that we never say that when we start talking about any of the dental problem, we just start when the age of 18 and above. But more of them where we lag behind is in the children cases. And in our daily cases, saying in practical life in our clinics, where we see that rather it may be in urban or maybe in rural areas, both we see that many of the children, basically their parenting is not quite good, whereas the counseling of the parents is very much required in the society. Then we will go into the treatments, because we all know that charity begins at home, and the very common point is that is when a parent is giving an education to his or her child, then we should always keep in mind that in the very early stage, I will give the slides in coming 2-3 minutes, is that the early stages is that we should always give a proper diagnosis in the early stage of the childhood, so that in every stage of the child's life, he should not, or he or she should not face any of the difficulties, which rather we will go for RCT and further details. So not wasting more time, I will start sharing my slide. Is there? So wishing everyone, every senior doctors and everyone, my colleagues, very happy Dentist Day. Whether we are all in the same professions. And the second thing is that it is the very important picture which I want to highlight in this seminar is that this is the very early stage. We can say the fetal picture of a baby. Whereas this newborn is not well known that how he or she will be getting any teeth disease. So in the very early stage, we should know that this picture, which it shows that the mainly this area, which is the main highlighted area of this today's seminar, is that see there in the very early stage, we are having this proper mandible and maxilla divisions. Rather, we can say that maxilla is joining of the two bone, where the mandible is also the joining of the two bone, which further become a single bone. But in this stage, which I want to highlight is that in every sequence of the life, if we start controlling our daily habits in the very early stage, then we can easily cure, rather we can say stop the formation of the dental caries, which is the main topic of the day. So this is the few cases which I have collected. This is the pictures of all the early childhood caries, like which we commonly see in our clinic is that the nursing bottle caries. The nursing bottle caries because this caries mainly it comes when the baby is in a nursing phase. So her
Your
his or
slides
her-
are not moving, doctor.
is it okay?
No,
Hello.
it is on first slide itself. Yes. Yes.
So
You can put more slideshow, yes.
So this one, this is the very early stage of where we find caries, the introduction of the caries in a dental life, basically. So in this picture, you can clearly visible that these are the cases of the nursing bottle caries. Nursing bottle caries itself says that when the baby is in a nursing phase. So this nursing phase is that when the mother and the mainly the parents both should teach the baby the good behaviors how to how to consume the food, how to manage his or her tooth in the very early stage, like brushing, using the proper brushing techniques in the early stage, so that we can we can just it helps the dentist to reduce the cases of the caries formation. So in first picture, we can see that this one is the basically is a healthy teeth. Okay, but in very next picture, we see that in many areas in India, we are having fluorides. So high concentration of fluorides is one of the main reason of the fluorosis, which we can see in the very early stage till when we calculate it in our routine studies, we just see that what the children has consumed from the age of 0 till the age of 14, because this 14 years of age is the very vital time period of each and every child, because we all know that the primary tooth falls or shed off and the permanent tooth comes. And in many of the villages areas where we have practiced already, we have noticed that the parents always say कि अभी तो दूध का दांत है टूट जाएगा, permanent दांत आएगा तो अपने आप ठीक हो जाएगा. So this concept should be changed. And in the last picture which we have seen is that it is basically the tooth has already lost its own enamel and dentin structure. Only the root cavity is there. So this root cavities, this is the main part where the caries starts affecting the permanent tooth. So this one is basically a small combination of what we are discussing on today's topic. Is that I have already mentioned that there is a left side and it is totally empty. So we should, we can all know that what we should place in this position. Yes, this smiling teeth. So this picture symbolizes that these Ayurvedic herbs, basically the ancient medicines which we use in our daily lives, by knowing it or by not knowing it. So these things which is very much responsible for keeping a teeth is strong and smiling. So moving on to our next slide. It is like already sir and ma'am both have said that Mr. Susud has already termed these diseases into two types, the oral diseases and the general gum diseases, and which we have also seen in Vedas also, which is our old traditional language. In Sanskrit, we have seen that Vedas, this Danta word has been repeated in many slokas. So this one, these are basically a few techniques which which we have came to know from our Vedas, that in earlier stages this Neem Dantan, which was used for the brushing technique, because that time modern brush and this all mechanical brush and automatic brush and this all vibrating brush, this has not came. So this was the main source of brushing. And same on the second slide, we have seen that gum massaging. This gum massaging is basically a practice which helps to reduce the bleeding gums, and also it helps to control of pyodia. Rather, we can say gingivitis. So, and periodontitis, sorry. And in this third slide, we have seen that cleaning of the tongue. The sir has also mentioned and ma'am has also said that cleaning of the tongue is very important, because this tongue which replicates each and every organ of our body. So we can also see that if we keep our tongue clean, then all the taste buds are always active, and this helps to identification of each and every taste, and this helps our body and brain to recognize each and every food taste which we consume in our everyday. And last, this one is that oil pulling technique. This oil pulling technique is basically which we know that keeping coconut oil and using of neem leaves or neem extracts, which we can use and which we have to keep for 5 to 10 minutes in our mouth, and continuously we have to mouth rinse with this liquid or the fluid, and it helps to prevent the formation of the cavity, as because we all know that this coconut oil is having an anti-carcinogenic property. This anti-carcinogenic properties, it helps to reduce the formation of the caries, and rather we can say it helps to kill the Streptococcus mutans and the lactobacillus in our mouth. These are the few things which we all know that it is very commonly used in our dental practice. This clove oil. Clove oil is basically we use in many of the forms. Direct clove oil is used for mixing of zinc oxide eugenol, which we have already mentioned in the second point, that zinc oxide, which it combines with the eugenol base, and it forms a sealant, which was used in many centuries back. And now it is the main like we are only following the old tradition to our new ones. Like this scenario is now that the old is merging with the new one. So this one which we have seen that clove oil, rather we can say clove oil and peppermint oil. This peppermint oil, it is having many active ingredients, and one of the main active ingredients of the toothpaste and mouthwashes. This peppermint oil basically it helps to keep our breath fresh. This keep our oral cavity, less bacteria affected areas. And third, which is the neem oil. Neem oil is used in the toothpaste. We all know that toothpaste and neem bugs, which we use as a dantan. Fourth is that amlaki. Amlaki is having a very good source of vitamin C, and it helps to fight the bacteria in the mouth, and it helps to build up the immunity system, which is one of the main reasons why the older ages persons, like the 80s of now, is having less cavitated tooth, whereas the new generation of the this 30s is having more cavitated tooth, because more the new formation of the pastes and the fluoridated paste has came. We all know that more the synthetic use of the chemicals are now is been actively ingredient of the toothpaste. This is babul. Babul, we all know that babul is one of the key ingredients of the toothpaste, which many of us we know by double babul also. So babul is having very much of the calcium, so it helps to prevent the loss of enamel. And third is the ginger. Ginger, we all know that ginger is basically an anti-inflammatory agent. So this anti-inflammatory agent, we in my regular practice also, I suggest many patients, that those who are suffering from severe gingivitis, which we can say chronic gingivitis, and I suggest them to do at least once to two times a day a mouth rinse with a warm water using this ginger extracts. So, and I have seen many of the good results in my clinics too. And at the end of the total scenario, I will like to suggest and like I would like to conclude basically. Sorry, I would like to conclude that this modern dentistry is this modern dentistry. It helps with the equipments and the technologies, which helps to not prevent. I will say that it helps to cure the cavitated tooth. Or we can just say, for example, RCT, which is very much common nowadays, but many of them we all don't know or not aware of it, that the gutta percha, the sticks which are used in the root canal treatment sealant in the final stages, it is purely made up of eugenol. So that is the main reason why we say that Ayurveda and dentistry is directly or indirectly are both attached to each other. So being a doctor, rather we can say that each and every one should keep our hands together and just make this world anti-cavitated world. Thank you.
Thank you very much. Thank you very much, Ayush. Excellent. You have summarized the whole thing in very brief. Very nice. Very nice. All the best in your future. Thank you. Thank you. God bless you. Agnihotri, sir.
Yes, thank you, Professor Parmesan Maji. Thank you, Dr. Ashish Chattopadhyay. Actually, we were just expecting that we have heard from Ayurvedic section the informations which are there in the text. So I was very much interested that how you are going to narrate this subject by your own side. So really, you covered all things. Especially, you shown the childhood caries. This is the most common, because parents in love and affection used to provide chocolates, cake, this pastry, etc., etc. And kids are very means opponent for getting the toothbrushing this thing. So always crying, always and this compromise, they used to get sometimes injury in the gums also. Because
Yes.
we have got our grandson, so usually we see now this is the time, this is the brushing time. Our daughter-in-law, our daughter always say like this. So that point is very important. And of course, my elder son got so tough time for this dental caries that he was appearing in 8th, and he, after getting the paper completed, directly came from Dehradun to the our family dental surgeon just to get it clear, because that was a pus pocket also. So, so you highlighted very important point. Parents are supposed to take care of the denture as such of their child, and not to make them more and more these sweet things available in a frequent manner. Thank you so much. Thank you so much.
Thank you, sir. Thank you, sir.
Thank you. Over to yes.
Now session is open, sir. You are mute.
We have got 10 in number in our guest list, and our out of our guest speakers, we are seeing Dr. Dilip Goswami and Dr. Nilakshi Dev Chaudhary, our respected Jagdish Domaji, and Dr. Purnima Rao ji. A few new faces and new in sense that they are here, and time is 11:15. So I've 10:15. So I've got almost 15 minutes. If the suggestions, query, or anything there in our platform guests is there in their mind, it's better they just raise their hand so that we will be in position to invite them and take their stand, whatever they are there to add on, so that our guest speakers are here to just make a reply for that. Dr. Dilip Goswami is very much here. So thank you. We invite you to please come with your some of the comments, suggestions, query, or anything.
Hello.
Yeah. Namaskar.
I'm audible, sir.
Yeah, namaskar. Good evening.
Okay. Hello.
Yes, you are audible.
Hello.
Yeah, yes, you are audible. Please continue.
Okay. नमस्कार sir सबको.
Namaskar ji, namaskar.
बहुत अच्छा लगा. So I was not being able to attend the whole session, but I have heard the speech of Dr. Subrat Nayak, who is a good friend of mine, and I was very much impressed from his lecture, and I express my thanks. And I think such type, this is a continuous process being continued to disseminate and to distribute the knowledge on different aspects of Ayurveda. And it is important because now also the dentist always say that you should brush your teeth 2 times daily. Previously also in the Ayurvedic classics, it is very nicely said that the toothbrushing should be done, cleaning of the teeth should be done twice in a day. And the different materials are also mentioned, which are not being followed by us due to many problems, due to some non-availability of the substances, as well as the development of the newer procedures, the toothpaste, different types of toothpaste, the toothbrushes. So we should be able to show the scientific society that Ayurvedic personnel, Ayurvedic scholars had given this knowledge previously also, and the new generation should get the knowledge appropriately, and they should disseminate their knowledge in the scientific society. So this is a very good lecture. This was a very good lecture. I have heard almost half of Dr. Subrata Nayak and the next one. So I am very impressed, and I hope again I shall be always associated with you in this mission. So thank you, sir.
Thank you so much, Dr. Sir. Especially, we are really grateful for your appreciation you extended for our guest speakers, and of course shown your friendship with the Subrata Nayak sir. It's a fact that we have got certain part of our body 2 in number, but we are 32 teeth. So naturally, the care should be almost at least 32 times or 16 times. Then only we will be making equal for our eyes, ears, etc. So our denture is very important, and so is important the instructions made by our guest speakers. Thank you so much for the participation, your inputs. In the same continuation, I would like to invite Dr. Purnima Rao. If she is here, we would like to have some input from her also. Dr. Purnima Rao, namaskar. Are you here? if she is taking time, Dr. Nilakshi Dev Chaudhary is also with us. Would you please like to tell some information regarding our this dental care or dental hygiene from Ayurvedic side, or any query or suggestion? Yes, please.
Good evening, sir. Very
Namaskar.
interesting session. Namaskar, sir. It was very interesting session, and regarding oil pulling also, it was very important. And can we do? We can also, sir, do oral gargle with Haridra
Yeah.
what? I feel that is also beneficial for our tooth and gums
Okay.
as oral rinse. And rest was very interesting, and I enjoyed the show. Thank you, sir, for selecting a very good topic and good speakers.
Thank you, ma'am. Thank you so much. Dr. Arun, yes, Professor Pawan Sharma ji is just informing for today's program. He has displayed this screen for today's program. Let us know what is going to happen on tomorrow.
Tomorrow is Holi, sir. Happy Holi in advance to all. In half of the India, today Holika Dahan is being celebrated, and half in tomorrow. So happy Holi in advance. And we are conducting on Kavi Sammelan Healthy Holi, which will be our 600th webinar. So please do join with 9 Kavis, 8 on screen above, and Manch Sanchalak Ranjan Vishad. So please, I would like to welcome you all tomorrow at 8 p.m. for our Healthy Holi Kavi Sammelan.
Thank you, sir. Thank you. Thank you. And I congratulate you for the best possible colorful design of tomorrow's program. Really, it's wonderful. It's touching. You already played Holi with all the faces and the persons, those who are a great poet and those who are going to present their valuable time to our webinar, which is reaching to a milestone that is 600th webinar. Great, great. Thank you, sir.
Thank you, sir. Thank you for your blessings. Because we can't play virtually, we are too far. Kindly continue.
Yes, so I was just inviting Dr. Amrinder Singh, if he is here, he may also increase our knowledge regarding today's webinar's topic, that is dental care with Ayush approach. And Professor Nishant Shukla is also just joining. So we invite both of them, and finally we will take the Ashirwad and the blessings of our respected Jagdishwar Domaji. Since time is, we are running with the time is constraint. So for next almost 10 minutes, I would like to have the blessings of all our platform dignitaries. Professor, yeah, you are saying something, Dr. Dilip Samiji? Are you saying something? Or Dr. Amrinder Singh, if you please join and say something. And if he is taking time, Dr. Shuklaji is with us, Professor Nishant Shuklaji, to make the occasion blessed by you, and then respected our Jagdishwar Domaji.
Namaskar, sir.
Namaskar, sir. Namaskar.
Namaskar, sir.
Yes.
दोनों presentations आज की importance है, और frozen foods के बारे में जो सर ने बताया, that was really
चेहरे पे बहुत तेज लाइट पड़ रही, प्लीज आपके चेहरे साइड से बहुत तेज लाइट पड़ रही, थोड़ा टिल्ट हो जाइए, या बैक लाइट ऑफ कर दिए. It's fine.
Sorry sir, थोड़ा
it's fine.
फ्रोजन फूड्स के बारे में ये काफी अच्छी इंफॉर्मेशन जो है वो सर ने दी, उसकी बायोलॉजिकल इफेक्ट्स के बारे में. दैट वाज वेरी मच इंफॉर्मेटिव. दिस इज ओनली फ्रॉम माय साइड टुडे. और एक चीज जो है ये एडिशन में करना चाहूंगा, ये मेरा थोड़ा एक्सपीरियंस रहा है. व्हेन आई वाज इन यूरोप, तो वहां पर दातून जो है वो मिलने लगे हैं. वो वो इतना मेजर्ड होता है, वो इतना मेजर्ड ये रखते, इक्वल डायमीटर का रहता है, इक्वल साइज का रहता है, कोई जो है वो ऑफशूट्स नहीं रहते हैं। डेंटल केयर के लिए वो लोग इसको जो है वो यूज करते हैं। 6 का पैक करीब 10 यूरो में वहां पर 2016 में बिक रहा था। तो हम जो है वो जो 1 रुपए की चीज यहाँ पर मिलती थी वो वहां पर इतने में मिल रही है। कल शायद ये होगा कि वहां से हमें ये सीखने को आएगा कि भाई दातून से जो है वो दांत किए जाए। तो दिस इज ओनली फ्रॉम माय साइड सर।
So they have made this thing means plain, just like after peeling it out, like the sugar cane.
Yes sir.
The sugar cane.
Yes sir.
So it looks like
ये बबुल के,
little bit, very
बबुल
handsome.
के, नीम के और करंज के, ये 3 मैंने वेराइटीज जो है वो देखी थी।
My God.
और ये इतने यूनिफॉर्मली कट ये रहते थे, और साथ में ये इंस्ट्रक्शन की हाउ टू परफॉर्म दिस वन, ये इंडिया से ही एक्सपोर्ट हो रहे थे।
बिल्कुल बिल्कुल। So no internote, no notes are there, only internote
Yes,
portion
yes,
as
yes.
it is apotitagram, like that. They have
Yes,
just
yes.
still in our this thought, and now we do hope that we Indians will like to use this means imported that on in a look-wise good shape. Yeah. Thank you so much for this contribution. Now, may I request Dr. Jagdish Domaji, respected Dr. Jagdish Domaji, to just conclude with his blessings. Respected.
Namaskar.
Pranam, sir. Pranam.
Of course, I lately joined while Dr. Nayak was speaking.
Yeah. Oh. Yeah.
Out of the frozen food, I do not know. I didn't hear anybody's lecture. But the one thing we can say that the word frozen took birth in which age? I say that very lately in modern age. When we people started practicing keeping freezer and something collecting vegetables and all those things for a week or for alternate days like that. But actually, strictly speaking, that using a freezer is not at all advisable according to the instructions of the Ayurveda. As far as fresh should be collected and made use of course, the days rolled on and the distance from market to living places might be a criteria. But in any circumstances, this freezing subject is, I say that, not healthy one, according to Ayurveda. And about the dental thing, dental surgery is a subject created in modern medicine separately. I do not know in anybody's speech rolled on this information that frequently in British Army, this was the ailment that most of the Britishers in early ages getting decayed of their teeth. That's why this has taken birth a separate subject in modern medicine as a dental surgery or a dentist like that. But as far as the practice of Ayurveda, I say that in wholesome, round it off, that in wholesome, Ayurveda covers each and every bit of the health. We need not beg with anybody to have instructions. Likely, I think a day before or some few days back, on my mobile only, some pictures was displayed that somebody was brushing and the foreign, that means NRI something, he was just taking some neem brick and he was brushing. While brushing, he was telling that somebody used to ask that why don't you brush with paste? Then the educator, he replies that if I use paste and spit, there the grass even will not grow. Grass even do not put up. Whereas if I brush with neem stick, the grass will grow. Then which is fertile to this land. That's why you people learn the natural practices, and this artificial is totally going to bring to the doom of the natural abundance. That is why our people, just now Shuklaji was referring about the Europe conditions. I feel very much pleasant while in north, while I will be in north and seeing on the roadside that sticks were sold on. But whereas in south there is not at all available. Though how we can collect? For example, for my neighbor there is neem tree, but they never I saw that they picked up neem stick and brushed. And whereas they will be brushing with a toothpaste and a toothbrush under the tree, under the neem. This is our nonsensical practice, what I say, because we are not accustomed to natural practices. Almost all artificial have rolled on and people making money out of it. And one another thing, I will give a practical information. Usually I used to brush with the paste neem right from age old, because my Guru Deva has asked all to use neem paste in early days of 1955, like that. Neem paste. At that time, only one brand was there, neem paste. And that is even till to this date I am bringing up and using. Even then, after brushing with neem paste, because our brushing system is almost all habituated. If we do not brush it and we see that something left out in the gums, if at all any mother early of child cleaning the teeth, I say that don't put a brush on the gums. I say you just with that means clean with either finger or the way accustomed to extent of using some stick and all those things. Till then, use powder, because almost all you will see that the gums will be cut off by using brush. Gums will be cut off. Whereas if you use tooth powder, no gum will get destroyed, I say. Even the system and the beauty of the gums can be seen. Beauty does not mean measuring the breast or measuring the thigh, all these things. Just we can say that, please smile for a while. If anybody sees that out of universal beauty or world beauty, whatever it may be, if they smile, none's gums will be in archery and beautiful condition. All the gums of the beauties will be cut off. There is no beauty according to Ayurvedic system or the poetry of Bharat, because even for a female, the poet used to sing the glory of the gums. But today's beauty's gums glory is nothing, worsened. Likely, I said that even for a babe, never practice brush. If at all to stick, go to stick. What about in children condition? There are number of tooth powders. For example, I will give information. Kottakkal presents one Dantakanti. Dasanakanti. Dasanakanti contains all spices, none less spices. If the baby also put with the finger, if it intakes, then it will work like a laxative. Go and find with Kottakkal, Aryavaidashala Kottakkal Dasanakanti, and it is an excellent one. All spices. And likely, even for Kandusha, gargling and all these things, so many oils are available, Irmedadi tel, Karanji tel, and all these things, neem tel, they can gargle. And at the easy available condition, Dashana Sanskar presented by many companies, You just practically observe. After brushing with the paste, you will have some gummy on the tongue. But whereas if you use Dasana Sanskar, even the gummy condition on the tongue will vanish. That means it contains Triphala.
Sir,
It
thank you,
contains
sir.
Triphala, where it washes. That is why so many natural presentations are there with Ayurveda. Our people need not go for simply shown modernization, which is ineffective. I say that ineffective. The subject for which we are struggling, or for survival which we are struggling, either through IES or whichever platform, I say that it is a pitiable condition, put ourselves in such a condition by foreign invasion. Thank you very much.
Thank you, sir. Thank you so much. Really, your blessings are always valuable, and you touched that area where our ancient and our forefathers were using the thing. It's the day is not so far that we may have the imported this neem, daton, etc. We do remember that say 30 years back, at the stations at morning 6 to 7 a.m., whenever any train reaches that station, may it be Lucknow, Kanpur, a small child, say of 10 years, 12 years, they rush to the coaches wise with the daton, 1 rupee piece, after 1 rupee, or there, जैसे चाय आज बेचते हैं, instead of tea, chai, they used to provide daton. At the same time, the bundles of daton were also sold with the vegetable shops there. Just we purchase and use on tomorrow. In this way, it was in very much practice. I do hope that the day is not so far that again we have to go towards nature, and we will have to start the gum. Because of this neem rasa, the astringent factor, it also gives the power and strength to chaladant. I mean, it constricts the this gum, and the root of tooth is being packed fully, so it itself giving a much more type of that help indirectly. So with your kind blessings, we are reaching to today's webinars at a closer end, and I refer back to Professor Pawan Sharma ji to please formally say thanks and conclude it.
Thank you very much. Just see, sir, I am observing from last so many days, if we maintain the time limit, in the same time, we are able to conduct 2 webinars on different topics. So thank you very much. Thank you very much. Good night.
2.5 hours is much more time. 2.5 hours.
Yes.
10 to
That's why
8
we
to
are
10:30.
limiting. We are requesting our speakers to conclude within 10 to 15 minutes. Only practical key points to be highlighted, so it will be better for everybody. Thank you very much, sir. Good night to all.
Good
Please
night.
do